Welcome to the Private Practice Clinical Supervisor, or PCS Exam tutorial. The purpose of this exam is to evaluate the candidate's knowledge and skills as required to be a competent supervisor or to manage a private practice in an alcohol and other drug or substance use disorder treatment setting. A presumed qualification of candidates sitting for this exam is that he or she is already certified, licensed, or otherwise qualified to provide AOD counseling services. This is not a counselor competency exam. The PCS exam was put together after comprehensive development and review by practitioners, administrators, and educators from throughout the United States, and is based upon relevant and scientifically validated standards. This includes the specific competencies and standards established by the U.S. Department of Health and Human Services, program management and supervision competencies addressed in the nationally distributed Clinical Supervisor and MAT Counselor publications, input from a national survey of over 200 subject matter experts, which established the relative importance of the required knowledge and skills competencies, an evaluation of the exam questions by a subject matter expert panel that reviewed and evaluated every question in order to make sure that the exam appropriately measures the necessary knowledge and skills of an individual serving as a clinical supervisor or managing a private practice. And finally, the entire exam and exam development process was subjected to a scientific validation process, a psychometric evaluation, by a nationally recognized test validation expert in order to make sure that the most important parts of the job are adequately represented and tested in the examination, and that the knowledge and skills of the candidates for certification or licensure as private practitioners or clinical supervisors are uniformly measured and tested. All of the PCS exam questions are based upon the material within 3 publications: the U.S. Department of Health and Human Services Competencies for Substance Abuse Treatment Clinical Supervisors, Technical Assistance Publication 21A, also known as TAP 21A, the Clinical Supervisor, which was developed and published by the Branding Research and Education Foundation, with contributing authors representing practitioners, administrators, and educators from throughout the United States, and the MAT Counselor, a training manual developed by Branding Institute that relates to the specialized skills and knowledge required in managing a medication-assisted treatment program. All of the exam questions were developed based upon the information contained within these 3 textbooks. If it is not in these books, it will not be on the exam. Here are our suggestions for preparing for the exam. Watch the tutorial, highlight the areas pointed out in the tutorial, and then go back and study the highlighted areas in the books. We are pointing out the parts of the books that we are currently testing on in the PCS exam. The tutorial will go by fairly quickly, so use the format of this tutorial to stop and replay any section that you need to go over so that you can highlight and put appropriate notes into your book. The reason most cited for failing this exam is not studying the material. You've probably learned most, if not all, of the information in these books at some point in your career, but don't assume that you can pass the exam simply because you learned the information at some point in the past. The exam contains 70 multiple choice questions. Each question has 4 possible answers. Select the best answer based on the material in the books, as we have pointed out and highlighted in this tutorial. You must score 70% or better in order to pass the exam, and you will have 90 minutes to complete the exam. So get a highlighter, get a pen or a pencil, and let's get started. Within the first publication, TAP 21A, this part of the tutorial is going to point out some of the important parts of the Section 2 implementation guidelines. There are other sections of TAP 21A that we will test on, but we will point those out in one of the later publications. So focus right now on the TAP 21A implementation guidelines. Understand what the implementation process involves. Know the recommended tasks, suggested for implementation and know what needs to be implemented. You will not be tested on the implementation guidelines at the state level, but you will be responsible for the information within the implementation guidelines at the agency level. For example, know all 6 suggestions and what each means within the implementation guidelines at the agency level. For example, in number 4, identify a leader to facilitate the improvement process and know all of the functions that they recommend the team leader be able to do. Know those guidelines and be able to distinguish between them. This next book, The Clinical Supervisor, is the source of most of the material that will be on the exam. You will be responsible for the information in this entire book. The only exception is Appendix A. Other than that, you should know the material in the entire book. We will go through this entire publication chapter by chapter and point out the areas that you should be most familiar with, starting with Chapter 1.1. You should know and understand the 18 identified results and themes of the study discussed in this chapter. For example, how being a counselor helped the individuals in their management roles, and then also know and understand the key areas identified for training. Know the information that is provided by the National Institute of Drug Abuse about the economic costs of alcohol and drug abuse in the United States. Also know the estimated healthcare costs and the consequences for alcohol and drug problems, as well as productivity loss information and crime and violence related costs. For example, that the National Institute of Drug Abuse states that drug abuse is estimated to have contributed to 25 to 30% of income generating crime. And that total costs attributed to alcohol-related motor vehicle crashes were estimated to be $24.7 billion. Also know and understand the articulated benefits of addiction treatment and how public awareness may be an effective way of preventing addiction at the individual, family, and community levels. Also know and understand the discussion regarding prevention education efforts about return on investment, or ROI, for successful treatment modalities and how the ROI can be improved for an agency. In Chapter 2.1, know what the Center for Substance Abuse Treatment says about the necessity for supervision in the substance abuse treatment field. Also know and understand the different developmental approaches or models of supervision that are discussed in this chapter. Know those models very well and be able to distinguish between them. For example, the social role supervision models are different from developmental and clinical models because, and know the reason why. There are a number of models discussed in this chapter, and you should know every one of them very well, and again, be able to distinguish between those various models. Chapter 2.2 is a fairly short chapter, but there is a lot of good information in here that may be tested on. Know and understand the general personalities of people who tend to be involved in caregiving agencies. Know the general supervision styles discussed in this chapter. For example, the autocratic supervision style may assume that the employee dislikes work, while the participatory management style may assume that the employees enjoy their work. Know the common motivations for employees as listed in this chapter. Understand the JCM motivation model and understand the 3 needs motivation model. And understand what delegating is and what it does for a supervisor, and understand how mentoring works.